Hi, everyone, and thank you for joining us for our Facebook Live discussion. I'm joined today by Dr. Ashwani Bhatia, Chief Medical Officer at BayCare Clinic, to talk about vaccines, a topic that is certainly at the forefront of everybody's minds today. Dr. Bhatia is here to answer your questions, but we're also going to outline for you a little bit more about how vaccines work, how historically they've been effective, and what the COVID-19 vaccines mean for Wisconsin's battle against the virus. Thanks for joining us today, Dr. Bhatia.
Thanks, Alicia, and I welcome all the viewers who are watching this. And today is a great day for BayCare Clinic as we are finishing up the first round of vaccinations for our clinical staff as well.
Absolutely. And before we get started, I too want to thank everyone for being diligent and safe in the fight against the virus. Dr. Bhatia and myself are joining today from separate locations, so we're taking precautions as well. If you do have questions today, please feel free to ask them in the comments below. This is your time to have sort of direct access to Dr. Bhatia here, and we'll do our best to answer those questions today in real time. If we do run out of time, don't worry, we'll have an opportunity to answer those or to continue answering those questions online after the live broadcast as well.
Sure.
So, Dr. Bhatia, you just mentioned it. This, of course, is top of mind for everyone right now. 2020 was a tough year for a lot of us. Dealing with restrictions and special protocols, those kinds of things. Can you give us an update on where we are with the COVID-19 vaccine and where that rollout is at the moment?
That's a very good question. We are at the level of vaccinating the phase 1A, the frontline workers, and especially the clinical staff fighting COVID on the front lines, our nurses, docs, as well as the people in the clinic who see patients or deal with the patients. Right now, we are also moving up certain groups of people from first responders, police officers as well. And hopefully, the next step is to get the community vaccinated as well.
Absolutely. And I know we're going to get into the science of the vaccines a little bit and a little bit more about that rollout as we move through our conversation today. But what does the rollout or the starting of the rollout mean for Wisconsin, the global fight against this virus?
This is huge. And as we were discussing today, this is the first step to get us over this pandemic, which we have been facing. Vaccination, especially the rollout of this vaccination, is a huge step for mankind. And I think we might underestimate it now, and we will realize how big of an event this is. This also means, especially for Wisconsin and for our community, that we will be able to vaccinate our frontline caregivers, some of them who have risked their lives taking care of our patients. What that also means that we will have less staff out if they're exposed or if they are ill. And I think we will be in a much better shape to take care of our patients in the community, not only for COVID, but other medical conditions as well.
Yeah, absolutely. A huge first step, as you mentioned. We're going to get into some of the kind of myths and those kinds of things that are out there regarding these vaccines. But I think it's an important place to start talking a little bit about the science of vaccines and how they work. But I think it's more important maybe to understand a little bit more about the immune system or the body's immune system. So could you give us a brief anatomy lesson about how our bodies typically fight off a virus?
So whenever let's say if you have an illness or a virus which enters your system, your body fights it with the help of certain cells, which we call it particularly, and I don't want to get into the specifics of it, but they're called T lymphocytes and B lymphocytes. T lymphocytes, some of them are able to take care of the infected cells. B lymphocytes are able to produce antibodies against the virus or any kind of organism which is foreign to us and fight it. But what the T cells also have memory cells. So once the virus enters our cells, the memory cells make a copy of those proteins or cells so that the next time the virus enters our body, we have the B lymphocytes, which are able to produce antibodies specifically against those cells and the virus to kill the virus effectively. But that's what we call as a natural immunity. And it takes time, and natural immunity varies from person to person. Sometimes your immunity takes a very different kind of a route and mounts a much bigger response, which is much more than it is needed. And then what happens around that is then you get really sick because your own body cells might work against some of the cells in our body and cause the sickness. And that's why we need vaccines. And the vaccines are created on that particular template where, especially if you look at the vaccines we are making currently, they basically enhance our immune system or condition them to fight the virus without the body getting sick or you not even getting the sickness in the first place.
Yeah, absolutely. I think you made, when we were talking earlier, just a good analogy about sort of that preparation and how vaccines help. Do you want to talk a little bit about that as far as the analogy between that and maybe training for a marathon?
Yes, and I was thinking about it when we were, I was preparing for this in terms of, what I'm going to talk about. And it's like conditioning for a marathon or preparing for a marathon, where if you go cold turkey and start running 26 odd miles, your body will kind of tire out easily and you might not be able to take care of your body and the body might even get sick. But if you start training for it, running a few miles every day, getting to a point where you are ready to run that marathon, you'll be able to breeze through it. That's exactly what a vaccine does to you. Vaccine prepares our immune system to get conditioned so that it makes certain antibodies against the virus, because the next time when the virus enters your cells or gets into your body, you're effectively fighting it and you're not even getting that sick. You're well conditioned to fight the virus.
Mm-hmm. Yeah, and let's talk a little bit about that too, because the technology behind vaccines is not new. We've had success with vaccines in the past with other viruses, those kinds of things. Can you give us a little bit of a history lesson on some of the other viruses or diseases that have been eliminated thanks to vaccines?
Absolutely. That's a very important question. Making vaccines for us worldwide is nothing new. We have eliminated certain diseases because of that. Polio is one. Smallpox is eradicated due to vaccination, and we still are able to vaccinate our kids, ourselves with diphtheria, pertussis, tetanus vaccination. We have vaccination for hepatitis B, and all have been very successful. Personally, I have been a part of a huge vaccination drive back home in India, where I come from, and it's called pulse polio vaccination. And although it was eradicated from United States many, many years ago, it was still prevalent in India, and the government of India took a big drive to eradicate polio, and we call it a pulse polio vaccination drive. And now I see myself in another vaccination drive, which is going to be much bigger than even polio, I think. So I'm fortunate that I'm a part of it. And as we know, vaccines are not new. The technology is not new in terms of developing vaccination and the knowledge behind it. Yes, some of it has changed, especially when we develop the new vaccines which are coming out, and they are literally groundbreaking technologies which are coming out now, and with the unprecedented speed that this vaccine has been created for COVID-19.
Yeah, and I know we're going to get into that a little bit. I do want to address that a little bit, because I think that's one of the myths that's out there, is that this vaccine is different, or these vaccines are different simply because of the speed at which they were developed, and maybe there was steps skipped, those kinds of things. Can you elaborate a little bit on maybe why that's not true?
I know I'm smiling a little bit because I think a lot of these are myths. These vaccines were, of course, developed at unprecedented speed because of the amount of investment, worldwide collaboration, and scientists just focusing on developing these vaccines, and multiple companies involved, the governments involved. There was federal funding. They did not skip the process. These vaccines have gone through the rigorous FDA clearance. They have gone through the process of safety trials, and it's as good as any other vaccine. I've taken it myself. I'm done with the 2 doses, fortunately, being a frontline clinical worker, but there were no steps skipped. Yes, they were developed very rapidly because of the fact that there was so much funding, investment, as well as brains behind it. And that's why we are here. It's a huge step for mankind. I've said that before, and I know it's difficult to see that right now, but as the confidence of people in the vaccination grows, as the frontline workers have taken it, and we are not seeing much of a side effect, I think it'll grow on the community, and I think it'll build some trust.
Absolutely. An unprecedented response for an unprecedented circumstance.
Absolutely. What a right way to put it.
We did have one question come in, and I know that you've dealt with this yourself as well. Brian would like to know, as a healthcare provider himself, how do I help vaccine hesitant staff get past the misinformation and hearsay out there to help them get vaccinated? And hopefully what we're talking about today will help with some of that, because I think that's part of our mission. But what would you answer?
It's a great question. I think convincing people, I feel, is by communicating effectively. Healthcare workers believe in science. They have gone through and they have seen the first-time effects of COVID-19. One of the ways to convince a lot of people is by showing them the statistics. 1 to 4% of the people infected with COVID worldwide could die of this sickness. They can get severe illness. As far as my calculation goes, it will be 50 million people who could die. I think through vaccination, we could save a lot of people from dying. I think it's no-brainer not to get vaccinated. As a person of science who believes in science, I think one of the ways I could help is by volunteering to get vaccinated as quick as I was eligible for, and making sure that I talk to my coworkers who are on the fence, dispel the myths through these channels and social media, which is a very strong tool. I think it's going to be very important for a lot of people to see their peers getting the vaccine, and I think that will motivate them to step ahead.
Absolutely. Great information. If you are just joining us, we're here today with Dr. Ashwani Bhatia, Chief Medical Officer at BayCare Clinic. We're talking in detail about vaccines and our health. We're taking questions in the comments below. If you do have questions, feel free to ask. We're going to do our best to answer those questions today in real time. We do have some questions coming in again, and I want to kind of jump to that, and let's talk about the safety of vaccines. We can get into a little bit about how these vaccines are working inside our body, but historically, how safe have vaccines been for individuals who are taking them, and what do you know about the COVID-19 vaccines?
Let's talk a little bit about the 2 vaccines that have been approved for emergency use, and hopefully the third one from Johnson & Johnson is coming out too. These 2 vaccines are called mRNA vaccines, and these vaccines produce a protein, which is mRNA is a messenger ribonucleic acid, or an RNA, which is a kind of a protein particle which is formed, which is taken from the virus or is in the vaccine and is injected, and it helps our cells to produce and make copies of a specific harmless protein, which is called spike protein. And once those copies are made, they eliminate the vaccine protein completely from your body, and then it recruits your immune system, as I talked about earlier, the B lymphocytes, to produce antibodies so that they can encounter the virus the next time and they can take care of it and kill it. So the protein is not inside your body; it gets eliminated. Number one. Number two, they're able to recruit antibodies, which are your own cells. They make copies of your own cells or your own protein. And third, they never enter your DNA. A lot of myths about, it changes your DNA and so forth. This is about these vaccines. Vaccines, as everybody knows, has been safe. There have been myths about, autism caused by vaccines due to certain products in the vaccines. It's nothing of that sort. There is a chance that with the second dose of the vaccine, you will get some myalgias, some febrile illness, which happens with a lot of flu shots too. But it's only for 12 to 24 hours. I experience it. It's nothing to worry about. You can take certain medications after the shot after a certain period of time. I think they're very safe. Historically, the vaccines have been safe. And right now, we are not actually providing vaccination to people who have had severe allergic reactions to the vaccines in the past. We are doing our due diligence. We are monitoring people 15 to 30 minutes, depending upon their risk factors. A lot of thought has gone through into this. And the fact that we have already probably given out, if not hundreds of thousands, maybe 1 million doses out already. And we have not seen a lot of side effects or major issues with the vaccination drive, except for maybe certain allergic reactions, which especially around UK, the initial reports came out where people who usually had anaphylactic reactions in the past had some allergic reactions. Most of them pulled through. I don't see this as any issue. I mean, this is a very safe vaccine, as far as the preliminary reports are concerned.
Absolutely. We do have some questions coming in, and I want to get to those. One of them you just touched on a little, but maybe we can go into a little bit more detail about some of the side effects that you have seen. You mentioned them being similar to, side effects or reactions that people may have had just from a basic flu shot. Can you talk about some of the side effects that you've heard of?
I mean, the side effects are not serious. Let's put it this way. To put that aside first, you will get maybe myalgias, muscle aches, which we call it, some headache, some heaviness in the head. You might get some tiredness, fatigue. You might get an occasional fever, some soreness at the injection site, because there is a little bit of volume to this this vaccine. But other than that, there have been no other serious side effects that have been seen. There has been, other than if there is a severe allergic reaction history to a vaccine component in the past.
Right, and you had mentioned that as well. So are there people or individuals in the spectrum that professionals are not advising get the vaccine at this time?
Yeah, I think people, especially women who are pregnant or breastfeeding now, we are kind of excluding them at this time. People with a very high level of, prior history of anaphylactic reaction or severe allergic reactions, somebody who carries an EpiPen, we have to weigh the benefits and the risks. And of course, the children below 16, they have not been studied in one vaccine and below 18 in the other one.
Great. Let's talk about the two vaccines that are currently on the market. I know there's one more probably within development stages coming out soon, or hopefully getting approval soon, and maybe some more down the road. The two, though, that are available now at this point, can you talk a little bit about the specifics of those? It's a 2-dose vaccine, correct? So when you talk about first and second, let us know what that's about.
Oh, well, they are 2-dose vaccines because they, based on the trials they found that the two doses definitely boost your immune system to tackle the COVID-19 because it spreads so fast. Usually, the one is the Pfizer BioNTech the vaccine, which is given day one and then within about 21 days, and the Moderna, which we can give as the day one, and then within 4 weeks of the first dose that they have to be given. Most of the side effects from the first one that I have noticed personally and talking to people is just muscle soreness with the first one. The second dose does give you some more muscle aches and some headache and some fatigue. But what I would advise you is that prior to the second dose, try to avoid taking Tylenol or Advil or ibuprofen. But I would say after the dose is being given, if you start experiencing those symptoms, you can definitely take some Tylenol to mitigate the symptoms. And the reason we don't want to give those medications beforehand, although there has been no specific trials to prove that, but some experts believe that it could mitigate the immune response. And if you actually are getting those muscle aches and some of these side effects and headache, it also shows that your immune system is working. So I think it's a very, very, I won't even say a price to pay, but it's a small price to pay to develop immunity. I mean, rather than being in a hospital and getting very sick.
Absolutely. We're going to talk about, we're getting a lot of questions about the rollout and when they'll be available to certain people within our community. Before we do that, though, I want to ask, because there are two different versions, do you feel like people should be concerned about which vaccine they're getting, or, first come, first serve, just get whichever vaccine you're available to get right away?
I would say just, whatever is available, you should get it. Both are very safe vaccines. The differences actually lie in how they are supplied and how they have to be preserved and, have to go through the supply chain. And I think right now, most of the institutions have done a great job in making sure there is the supply chain is maintained and they're injected safely. They're keeping a record. I would say once the vaccine starts rolling out to the community, which I anticipate definitely by March, because I think we are moving very fast. I think so. People should line up and get this vaccination.
Fantastic. And let's talk a little bit about that. You expect March, maybe early spring, for this to be rolled out to the general public. Can you talk a little bit about who's getting the vaccine now, and then what that rollout plan kind of looks like from the state?
So we right now, we are in a phase 1A when we are giving it to the frontline workers, the clinical staff, and all the medical workers of various degrees who deal with patients. And now I think some of the EMS providers, first responders, police forces, as well as grocery store workers and teachers have been included. And I think the next step would be is to start looking at a group of patients who are 65 and older, or who are less than 65 with chronic comorbid conditions, especially those who can really get sick if they contract COVID.
Mm-hmm. And as far as has any of the information been released as far as when that will be available to people, or how that will be available to people?
No, at this time we are not, but we are expecting it. I think so institutions like ours are engaging with the DHS and Department of Other Health Services to start working on a plan how we are going to do that. I know the local national pharmacies have been roped in, and they're hiring workers as we speak to start a massive drive in community vaccination as well.
Excellent. Some questions that are coming in. Do you know whether or not, and this is a little bit out of the wheelhouse, but whether or not employers will be able to make the vaccine mandatory for their employees?
No. And this is my personal belief as well. I don't think so. The vaccine should be mandatory. I think we should make every effort to communicate with the community that the vaccines are safe. And as more and more people will get the vaccination, I think the people will jump in. They will come together and believe in this process. But right now, I don't feel the employers would make it mandatory.
Excellent. And do you know, will the vaccine cost anything for those interested in receiving it?
No, it has been rolled out free of cost by United States government. It is going to be completely free of cost.
Okay. So I want to talk a little bit about the immunity that you speak of, and the importance of the number of people in our population that we get vaccinated. Once individuals currently receive the 2 doses of the vaccine, what does that mean for their immune system?
Well, once they get vaccinated, they basically can get to the point where their immune system would be making antibodies which will kill the virus. They won't have significant illness. They might not have any symptoms, but they could still transmit it, because we don't know how efficacious is the vaccine in terms of whether it will it will be able to recruit immune system to the point that it will kill the virus completely so that it doesn't even spread to the next person, or it will be able to just affect the virus enough that it will not affect the individual, who is immunized, but could be still potential to be transmitted to the other person. So what it means for a person who's immunized with 2 doses is that the chances of them getting very sick with this disease are going to be very, very low. Efficacy is around 97, 98% in that terms, but we still don't know whether the immunity is going to be just limited to the individual, or the immune system will affect the virus so much that that individual cannot even transmit. Right now, I think we are taking we are on the side of caution, and we are still going to ask people to mask, make sure they do hand washing, social distancing, and so forth, so that if there's a chance that they could spread the virus to other people who are not vaccinated, we should take those precautions as well. This is an additional tool. Vaccination is the step to get to normalcy, but we have to vaccinate enough people to get off the social distancing part, hand washing, masking, and making sure we also protect our people around us.
Absolutely. I think that's an important distinction to make, that getting the vaccine doesn't necessarily mean that we can, have big gatherings, those kinds of things, but it's an important first step in this fight. One of the other questions that come in, and it has to do with the transmission. This is being studied at the moment, you said. How long do you think it will take before the data shows that the vaccine prevents COVID transmission?
I would say that you need a substantial data. I would say 6 months to even a year of data will be needed. But what we know is that COVID does spread very quickly. And the initial estimates do show that we will need about 70 to 80% of the communities immunized before we can call it a herd immunity. And what does that mean is the herd immunity is the level of immunity inside a community which will ensure that the spread of the virus is not rampant at all within that community. And I think that's the big question that we will have to answer as we continue to vaccinate more people. And the way we will answer that question is if more and more people get vaccinated.
Absolutely. And in comparison, you talked about that herd immunity. Compare that to something that maybe more people are familiar with from a flu standpoint. What's herd immunity from a flu standpoint each year?
I think it's about the same, around 70 to 80%. Some diseases, you can make a case of 55 to 60% at certain years of flu, because the flu changes every year.
Right.
Their strains, and so does COVID to some extent. But for flu viruses, depending upon year to year, you can gain herd immunity by 55 to 80% vaccination rate.
Yeah, and it's interesting that we brought up the flu, because I think a lot of people have been comparing COVID-19 to the flu. The vaccine will inevitably be compared to the flu vaccine, that kind of thing. One of the questions that we got as well, and this is probably something we may not know yet at the moment, but do we know that is this a vaccine that we're going to have to get annually like we do the flu shot, or what's the determining factor there?
I think the determining factor would be definitely how many strains of COVID we find, and if COVID-19 virus mutates, which we know it does. We have found a new strain in UK. By the way, the vaccines will cover that and will immunize us against that strain as well, based on the initial study and the reports. But again, I think we might require to have vaccines every other year, or maybe every year, depending upon how quickly we find strains of COVID-19 which change or mutate, as we say.
Excellent. Another question that came in, and this was something I believe that the CDC has rolled out, it's the VSafe app. Do you know if that information will be available in real time to non-medical people? I think it's an app that helps track sort of data from the vaccine, or from people who have been vaccinated. Yeah,
there is a VSafe, app, and I think the CDC website is available normally to everybody. And apart from certain aspects of data analysis, which are going to be very technical, I think most of the information will be updated very fast. If you look at the pandemic also last year, the CDC did a pretty effective job in updating their websites and getting the real-time information out to the community.
Yeah, the CDC has done a good job of updating, as well as the health services website here in Wisconsin. We're going to talk a little bit about some of those kind of myths that people have been hearing about and how we can debunk those too coming up. Really great information, Dr. Bhatia. I want to thank you for being here with us. If you do have questions, those of you watching, please feel free to ask them in the comments below. We'll do our best to answer those in real time. We're going to start wrapping up, and I want to kind of go through sort of this Mythbuster type summary that we've kind of put together here. Some of these myths have been circulating. Some of them we've talked about today. Some of them we haven't. There is a lot of misinformation online. We want to make sure that we are kind of focusing that information and getting people the information that they need to make the best decisions for themselves. So the first myth I want to ask you about is again, just to reiterate, the myth out there is that the COVID vaccine is unsafe because it was developed so quickly. So can you debunk that one again for us?
Again, it's a myth, absolute myth. There has never been in the history of mankind that a vaccine has been made so fast. As you said, unprecedented times need unprecedented efforts, and that's what has happened. The amount of investment, the amount of organization and cooperation amongst countries, continents, has been done in this situation. It's tremendous. This proves that if human race is faced with this kind of adversity, we can all come together, regardless of where we are in the world, and come up with this kind of an achievement. And I would say this is nothing short of a achievement of greatest proportion in the history of mankind. And there were no steps skipped. It's a total myth. It's a safe vaccine. It's a new technology. It will change how the vaccines are made in the future. Not only we will be able to deal with the pandemic now and COVID-19, but we might be able to have a lot of lessons learned to deal with infectious disease in the future. This is a great breakthrough. Absolutely a myth, Alicia.
Wonderful. I want to talk a little bit about the side effects again. We had mentioned some of the individuals who have maybe had reactions to vaccines in the past. Mm-hmm. Karen is saying that she's had chills and fever from a vaccine in the past. Should she be concerned about the COVID-19 vaccine?
No. Chills and low-grade fevers are common, especially in vaccination, especially any viral vaccination. And just like flu, she should not be absolutely concerned. If she starts getting those fever chills, she could take medications for that after the vaccination, and if she cannot tolerate it, but that should not preclude her from going ahead and getting her vaccinated.
You had mentioned it before, that being the body's response, meaning it's responding to the vaccine in the way that it should, correct?
Absolutely.
Great. So keep those questions coming. We're gonna get back to the myth busting that we had planned for. The other myth that I wanted to address is that the COVID-19 vaccine will alter a person's DNA.
No, it's absolutely not. I don't know how to even answer that question. These mRNA vaccines is again, as I said, they make a harmless. They get into your body. They give a signal to our body to make a harmless protein, which is found on COVID-19, which is called a spike protein, and they make copies of it. Then the protein particle, which is from the vaccine, is trashed, it's taken out of your system. It never enters the nucleus of the cell, which is the central part of the cell where the DNA is. So it never even enters the nucleus of the cell, so it will not change the DNA.
Mm-hmm. And just talking about the makeup of the vaccine, the ingredients, those kinds of things kind of answers the next question as well. But just address it if you would, that you can get COVID-19 from the vaccine. Is that a myth?
Well, we are not injecting a virus, so so you cannot get COVID-19. It's a protein particle. It's an identification protein from the COVID-19. So for somebody to get COVID-19, you'll have to have the whole virus in your body. So we are not injecting that.
Absolutely. Again, addressing those side effects, one of the myths out there is that there are severe side effects to these vaccines. We've already addressed it quite a bit today, but if you would just reiterate again, the side effects are not severe.
Apart from having an allergic reaction, which is very severe, if you had a prior allergic reaction to the vaccine or any medication, or you take an EpiPen, the reactions are very, very mild. You can get some myalgias, you can get some fevers, headache, you might feel tired, which can be managed with some medication after the vaccination. Again, haven't seen a lot of severe reactions from vaccination.
Great. This is an interesting one, and one that we really haven't touched on today, but one of the myths out there as well is that the vaccine could cause infertility in women. And I do want to take a moment to address that. Again, I think, go ahead.
Well, yes, there is a 3 amino acid sequence, which is common with the placental proteins, but it is made up of millions of amino acids. There is a small chain which does have commonality with that, but none in the trials or in the studies have shown that it will cause infertility. The chances of it is negligible. So I think it's a myth, and there are nothing to report here to say it will cause infertility at all. And I have addressed some of these questions even outside of this this streaming as well, and it's not.
Great.
I do see a question coming directly, if there are any pre-vaccination protocols that might aid in lessening allergic reaction or cytokine storm reaction to the vaccine. I would say no. I know some of the people want to take Benadryl or Tylenol. I would advise not to take Tylenol or ibuprofen, especially before the vaccination, because it might potentially can blunt your immune response to the vaccine, which is important. I think the best thing to do would be is if you develop certain myalgias and if you cannot tolerate it, is to take some Tylenol or some ibuprofen or something of that sort afterwards. I don't think so. Taking Benadryl before the vaccination would prevent a severe allergic reaction of any sort.
There was also another question similar to that, just in regards to vitamin D and other vitamins. Will vitamin D be needed as much after the vaccination, or isn't there any research on that yet?
No, there's no research to suggest that any kind of vitamin will help us in regard to vaccination.
Great. One of the other things I wanted to address too is if you've already had COVID-19, what is the policy so far as the vaccine goes? And do you not need to get the vaccine if you've already had COVID-19?
I think you should get. I think right now some of the institutional protocols said that you can get the vaccine after 90 days. Some of the institutions are looking at 60 days after COVID, contracting COVID. You would have some kind of immunity, and which is called the natural immunity after you get COVID, but it varies from individual to individual. So to be on the safer side, I would say the people who have contracted COVID-19, they could wait for a certain period of time, whether it's 60 to 90 days, but I think they should go ahead and get vaccination. We have seen cases where people who have gotten COVID-19 after the first time they contracted it and have become ill. So I would suggest that to be sure, they should get the vaccination your own immunity varies from person to person, so we can't be sure to see. There are some studies going on talking about looking at antibodies and what is the right percentage of antibodies, whether it's after contracting COVID and or even contracting or developing antibodies after the immunization. But we'll have to wait for those studies. At this time, we cannot be sure that the natural immunity will be enough so that the person doesn't develop COVID-19, and maybe they develop it with another strain. So remember, the vaccination helps to cover multiple strains too.
Absolutely. I think this is something that we'll be studying for quite a while.
Yep.
The last myth that I had to address, and we talked about it again, but before, but I do want to ask again, getting the COVID vaccine means I no longer need to wear a mask or practice social distancing.
Absolutely not. I think you need to still protect people around you who have not been vaccinated. That's definitely the number one. Vaccination, I said, is another tool in our armor to go ahead and start to see the end of this pandemic. But we still have to mask till we get to a point where a lot of members of our community are immunized. So continue hand washing, continue social distancing, avoid congregation, try to do your best to make sure that you're not close to people, make sure you're masked. This is going to be essential. Vaccination, as I said, is the start of the finish of this pandemic, and a very important step.
Absolutely. Well, thank you, Dr. Bhatia. We do have a couple of questions that came in. We will go ahead and answer those online after today's broadcast. I want to end here. I know yourself and BayCare Clinic providers, in conjunction with our partners at Aurora BayCare Medical Center, continue to remain on top of this information. Are there resources out there that you'd suggest if people are looking for more information on these vaccines or how they can eventually get them?
Yeah, I mean, I think they should look at Department of Health Services. They could, even look at, some of the news coming out of institutions, healthcare institutions as well. Look into social media. I think healthcare institutions like ours have to be a little more proactive in making sure that we provide all the resources to our community members. So watch our BayCare Clinic page as well. We will be updating that to make sure that we have all the resources. And as the vaccination rolls out, I think there will be a lot of news around that. And we are influencing the Department of Health Services at our level to make sure that people in the community know where to get these vaccines. As I said, national pharmacies have been included. There's a talk about healthcare systems also being a point of service for the vaccination, especially for certain patients. So there will be a lot of information to be rolled out, and I hope our viewers and our community members watch out for it.
Absolutely. Well, thank you so much for taking the time with us today, Dr. Bhatia. We really appreciate it. I think our viewers really appreciate it as well.
As I said before, I thank everybody who joined us today, and thanks for all the questions. They were great questions, but again, this is a great first step. Now we have to do our part. So let's go Wisconsin.
Absolutely. Thank you so much. Thank you everyone for joining us today. To be alerted about live content from BayCare Clinic, be sure to like us on Facebook and click on the bell icon below to subscribe. Again, Dr. Ashwani Bhatia is Chief Medical Officer at BayCare Clinic. If you have additional questions, please continue to ask them in the comments below. We'll do our best and continue to answer those online after we conclude the live broadcast today. To learn more about BayCare Clinic or to request an appointment, visit baycare.net. Thank you and have a great day.